Welcome back. March is Colon Cancer Awareness Month. We have Dr. Clayton Spiceland joining us now from TriStar Southern Hills to talk more about the screening process. Dr. Spiceland, good morning.
Good morning.
Thank you for being here with us. When we say screenings, when it comes to colon cancer, why are they so important? What does that look like?
Yeah, so thanks for having me to talk about this very important topic. So colon cancer, when it's detected at an early stage, like in a screening colonoscopy, is actually very treatable.
Okay.
And the prognosis is often good. But one of the exciting things about screening is that we can often prevent a colon cancer from occurring in the first place.
Wow.
And so to do that, we use a procedure called a colonoscopy, which is the gold standard colon cancer screening test. And during that procedure, we're looking for small growths in the colon called polyps.
Okay.
And during that procedure, we can actually completely remove those polyps and prevent them from turning into a cancer down the line. And so that's the exciting part.
And also exciting to talk about AI technology being used to screen for colon cancer as well. Tell us about that and how you all are using this at TriStar.
Yeah, that's been a pretty amazing change, and we're so excited to have that. So while I'm performing a colonoscopy, we've got our artificial intelligence platform that's actually interpreting the live image of the patient's colon at the same time I'm doing the procedure.
Wow.
And it's using a library of millions of pictures of polyps that it's been trained with to try to detect small polyps or other subtle irregularities that may not typically be picked up on, and it can alert me in real time that, hey, maybe there is something there that I need to look at a little closer.
Wow, so you can get a diagnosis quicker, is that what it would mean?
Yeah, it actually increases our chances of finding those precancerous polyps so they can be removed right then, and that has been shown to decrease the risk of colon cancer down the line.
Wow, what about the accuracy using this AI technology? How does that differ from the traditional sense?
Yeah, and so you know, this has been studied extensively, and one of the most exciting things about it, it has been shown to increase polyp detection rate, which is our primary quality measure, and that in turn decreases colon cancer significantly for the patients who are screened using this technology.
Wow, amazing. It's just incredible to see the advancements in medical technology and how AI is getting incorporated into all that as well. Now, when it comes to screening for colon cancer, who is a good candidate? Who should be getting screened, and how often?
Yeah, and so there was a change a couple years ago as we were noticing that younger patients were developing those precancerous polyps. And a few years ago, the change was made to make the average risk screening age 45. So anybody who's 45 needs to be screened for colon cancer. Now there's certain populations that should actually be screened younger. And so if you have a family history of colon cancer, you should talk to your primary care provider about the ages that you've had family members diagnosed, and they can give you some guidance on when to get screened. And something else that we ought to talk about is that even if you're not yet 45, if you're having symptoms, so if you're having blood in your bowel movements, you're having change in your bowels, those are signs that regardless of the age, you need to get that investigated.
Wow. How often should you be getting screened?
So if you come in and get your colonoscopy at age 45 and everything looks good, then you don't have to do another one for 10 years.
Oh, wow.
Yeah, and if we end up removing a polyp or two, which is common at the screening age, we would typically bring somebody back in 5 years.
Okay. Why is it so important for you to share this message and address this topic with the rest of the community?
Yeah, I think the emphasis should really be on prevention. So even though we call this a colon cancer screening test, the opportunity for preventing cancers is the most exciting part. And you know, you bring somebody in and kind of remove those small lesions in the colon called polyps before they have any symptoms, and we can actually prevent a cancer down the line for that patient.
And saving lives at the end of the day. All right, Dr. Spiceland, thank you so much for your time
for
this morning and your insight. Folks, we're going to have more information as well on our website. Just go to WKRN.com and look for the Newsmaker tab.